today, and this is Kismet, marks the second anniversary of the landmark Supreme Court decision Dobbs versus Jackson. And so really just, I believe in signs, really just comforting us that here in the state of New Jersey, we are doing right by human beings, women and children. This ruling, as you all know, has caused a seismic shift in the fight for human rights in our country. Its fallout has had profound implications, not solely on just issues of abortion and reproductive rights, but on the broader fight for the right for anyone in this country to decide what is right for their own bodies. Immediately after the court's decision, 24 states have banned abortion or have severely restricted reproductive health care. Our worst nightmare, when we all thought, like, why is it that we have to keep doing these things? You have to keep doing these things because you have to assume worst case scenarios for the future. 1 out of 4 women in the United States are expected to have an abortion by the time they turn 45 years of age, according to a study at UMass Medical School. And despite the justifications given for bans in those 24 states, the number of abortions in the United States increased 11% last year post-Dobbs. It is the highest rate measured in the United States over a decade. In fact, we saw in states where abortions are now illegal, 171,000 women leave their homes to travel the other states. And I want you to think about that person. That person has access to money, speaks the language, has transportation, knows where to go and how to get it done. Strip all those pieces back and I can tell you, God only knows what's happening in those states. It's as if you're reading a history book from 100 years ago. So I'll go over the bills very quickly, and then we'll leave it open to our partners. The first bill, and I want everybody to know that we parsed and separated each of the bills because this was a huge package that was dropped in 2020, and it hasn't moved. So in an effort to be sure that we keep chipping away at human protection rights, we've divvied up and separated the bills, and I'll tell you which ones came out of the big bill, 1 through 4. Regulations for providers, it's just codifying regulations. The insurance bill, which the Senate President and I will be putting forth today in the Budget Committee, aligning with the governor's budget message that no co-pays or adverse actions by insurance companies for accessing reproductive or gender-affirming health care services. Patients and providers' rights. The SHIELD protections protects rights of people receiving reproductive or gender-affirming health care and IVF. Grants provides grants, funding opportunities for things like the security of facilities, training programs, etc. And it also requires the Department of Health to study the gaps in access and services. These other bills are bills that we've added since then. Data privacy, data protection of people accessing reproductive health services. Unfortunately, when we travel the country, we know that people who use period apps, there's a thing where they start tracking, they can potentially track you now, and we have to be sure that anyone who's using an app based on their own body's functions, that is something that is just kept to their own personal privacy. Universities, requiring institutions of higher education to develop a reproductive health service plan to ensure they have sufficient access to contraception and services. A loan redemption program, so in the medical field, as we see across the board, we do not have enough individuals going into these spaces, whether it's obstetrics care, et cetera, or maternal or infant or mental care in these spaces. We're creating a charitable donation, which we've done for a bunch of different other concepts, creates new funding streams to support reproductive health care services via the tax return process. And Senator Turner, who would have been with us today but could not, the Emergency Contraception Access expands access to emergency contraception by not requiring a prescription or authorization to access. And so I know that's a lot. But what I wanted to reiterate, with, especially with the reporters, one bill is just separating the pieces out so that we have over the summer so that we can really do a deep dive and work. This week, we will deal with the insurance copay bill. And as we come into the session into the fall, we'll work collectively together to be sure that every woman, child, and human being is protected here. I know this is a big thing, but the Senate President and I have talked about it. I just said to staff, and I want to give a great shout out to Rose Farias and Allison Myers, who worked with all of the groups here, and to all of you for your patience in getting us to this point today. When I used to draft pieces of legislation, I would always think the ceiling, because I was always thinking positive. What if? I never thought about the floor. And I will tell you that I've learned the hard way that you have to think about the floor. So we have to look at the state of New Jersey under the worst case scenarios. What if the administration changes to someone who's dramatically far thinking from what we're thinking today? What if the Assembly and the legislature are aligned? What protections do we have in place? And at some point, we should be talking about a constitutional amendment to protect the right to abortion here in the state of New Jersey. So with that said, I want to introduce to you a person who is my friend, is my partner, and has been working relentlessly to move families first here in the Garden State, Senate President Nick Scutari.
Thank you, Majority Leader Ruiz. It's actually almost sad that we have to be here. I speak to people throughout the rest of the country sometimes, and New Jersey is a beacon of hope for so many folks seeking access and seeking reproductive freedom and seeking abortion access. And I'm not afraid to say that. I've said that my entire career. I can't possibly believe where we've come and where we are in the last 20 and 30 years, where this is now back on the forefront. I thought this was settled law. I thought that this was something that we would never have to deal again, but now it's back on our doorstep. When you look at a map of the country and you look at how starkly different the middle of the country is than the parts where we live in, it is virtually impossible to gain access to a gynecologist or a medical provider to provide services for women's health. I mean, we have changed America fundamentally with this ruling. I mean, there clearly is two Americas right now for women that are seeking reproductive care and freedom. They have no place to go in the middle of the country. And as the Majority Leader said, there are individuals that have the money, the access, the knowledge to be able to move and go to other places where they can get those services. But there are so many countless others that are just stuck, that don't know where to go. And the enormity of the responsibility of carrying to term something that someone that they didn't want to is just, that's underrated in terms of how much people are being asked to take on. And where's the government's role in this? They don't care what you do after that has happened. They don't seem to want to give you any money for that, but they also want to ban you from taking choices and responsibilities that you're looking to do right at the beginning of your life. In many terms, early parts of women's lives. So I'm shocked, and I'm appalled, and I'm proud to be here with Senate Majority Leader Ruiz to help move forward on some really important pieces of legislation. And I could not think of a more important day to do it, and 2-year anniversary since this horrific ruling has come down that has fundamentally changed the face of healthcare in the country. And I wholeheartedly agree that at some point in time, a constitutional amendment making sure that these rights stay in New Jersey law going forward is something we absolutely have to consider doing. I've considered it once before. I'd like to see us do it again, because elections have consequences, and people can't possibly imagine New Jersey changing. But we had a Republican governor for 8 years. I remember slashing of funds at that point in time, where we were losing a 2 and 3 and 11-to-1 match from federal government just because of the differences that we had with respect to what we thought fundamental freedoms and reproductive freedom meant. And so the opportunities and the money that was lost over that period of time still strikes me. So these pieces of legislation are extraordinarily important, but I think we need to move that football down the field, get some of these pieces across the goal line, and continue to the ultimate goal, which is to protect women's rights indefinitely through a constitutional amendment. So with that, I want to say thank you, Senator Ruiz, for helping me. Thank you. And congratulations, everybody.
And now from Planned Parenthood and Cherry Hill Women's Center, we have Roxanne Sataki and Caitlin Wojtowicz.
Good morning. Thank you, Senate President Scutari and Senate Majority Leader Ruiz, for having us here today. And thank you to all of the partners that have also joined us today in support. My name is Caitlin Wojtowicz, and I serve as the Senior Vice President of Public Affairs at Planned Parenthood Action Fund of New Jersey.
And my name is Roxanne Sataki, and I serve as the Director of Public Affairs with Cherry Hill Women's Center, located in South Jersey. And together we represent 2 of the largest abortion providers in the state. We're proud to stand here today to support the introduction of the Reproductive Freedom and Health Equity Bill package.
We recognize the historic impact of today's announcement, and as was mentioned briefly before, today marks exactly 2 years since Roe v. Wade was overturned. Since then, 21 states and counting have banned or severely restricted access to abortion. And we know the fight isn't over. Those who oppose our personal freedoms and seek to control our bodies, our health, our futures through continued attacks on abortion, contraception, gender-affirming care, and IVF, and more. New Jersey has proudly supported reproductive health care and access to bodily autonomy, but there are still critical protections and innovations that New Jersey needs to meet this moment in a post-Roe healthcare landscape. This bill package will continue to build on the historic strides and investments that this legislature and governor have made in reproductive health care.
And as abortion providers, we're really focused on the health and the safety of our communities. And in these last 2 years since Dobbs, our role has evolved. We are helping our communities navigate a radically shifting legal landscape and emboldened anti-abortion extremists. We echo the gratitude that we've heard today from others, and we look forward to working with members of the legislature to ensure the package of this important bills are moved. We know that they're going to meaningfully improve the experience of all those seeking and providing all stigmatized healthcare services in New Jersey.
Thank you.
Thank you. Now from the ACLU New Jersey, Alejandra Sorto.
Good morning. I'm Alejandra Sorto with the ACLU of New Jersey. I'm grateful for the opportunity to be here today along Senate Majority Leader Ruiz, allies, and friends. The Supreme Court decision 2 years ago to overturn the constitutional right to abortion represented a devastating moment for our country, and it was the result of years-long effort by anti-abortion proponents to strip millions of people of their reproductive autonomy. While our rights here in New Jersey are firmly protected under our state constitution and state laws, that moment 2 years ago was a resounding call to action for us as a state to do more, to take legislative action to ensure that abortion care is not just legal, but affordable and accessible to all in our state. We're grateful for the leadership of the Senate Majority Leader in advancing legislation to make that a reality and make sure that reproductive freedom is a reality, particularly for the communities most harmed by barriers to health care, especially undocumented people, immigrants, people of color, people who are low income, people living in rural areas. Reproductive rights and health and justice are intersectional. Attacks on reproductive freedom are deeply rooted in systemic racism and control. As a state, we must be unapologetic in our support for reproductive freedom. This is about racial, economic, and immigrant justice. We look forward to working with lawmakers to ensure that abortion access is legal, affordable, and accessible to all, and in striving for a future that upholds our freedom, our humanity, and our opportunity to thrive. Thank you so much.
Thank you.
Now from Garden State Equality, we'd like to thank Christian Fuscarino and their speaker, Jamie Zug.
Hi, I'm Jamie Zug. I'm a member of the board for Garden State Equality. I'd like to thank, on behalf of Garden State Equality, I'd like to thank Senator Majority Ruiz and the Senate President for introducing this critically important bill package. This bill package expands access for pregnant individuals to abortion care and other types of reproductive health care. This is an important issue for every community in our state, including the LGBTQ+ community. The bill package also includes groundbreaking Shield State legislation for New Jersey. In the past few years, healthcare decisions that rightly belong to individuals and their providers have been restricted or banned in over half of the states when you look at the full number of types of health care that have been subject to such restrictions. For the first time in New Jersey, consistent with national best practices, this bill package offers protections for providers in the state, not only for abortion care, but gender-affirming care and assisted reproductive technology. We urge the legislature to pass this bill package and protect providers respecting all health care that is restricted in other states.
And finally, we welcome the National Council of Jewish Women, Essex County Section, Phoebe Pollinger.
Thank you. Thank you. Phoebe Pollinger, NCJW's New Jersey State Policy Advocate and Chair of Essex's Reproductive Rights Committee. Senate Majority Leader Ruiz, President Scutari, who's stepped out briefly. On behalf of the National Council of Jewish Women, Essex, Bergen, Jersey Hills, West Morris, Metro Jersey sections, and Unitarian Universalist Faith Action, New Jersey, we applaud the introduction today and support for the package of this Reproductive Freedom and Health Equity Act, beginning today with the insurance bill. This is another step forward in breaking down the financial barriers to accessing abortion care and the full range of reproductive health care options. Many faith communities share the belief in bodily autonomy, in respect and dignity for the decisions we choose to make, and in the right of everyone to both reproductive and religious freedom in making those decisions. So many of our respective faiths center equity and justice in our texts and teachings. In the Torah, for example, we are instructed to remember those who live in the shadows, to never forget those whose opportunity and freedom are not guaranteed. We are commanded to pursue justice. Unitarian Universalist principles also call upon us to work toward justice, equity, and compassion for everyone. In accordance with this commitment to justice, we must affirm the right of all people to have access to abortion care and all other forms of reproductive health care. This is a fundamental belief that we all must be free to follow our conscience when making decisions about our health. As we move forward to ensuring that everyone in our state not only has the right to abortion and reproductive health care, but also full access to those rights and health care, we must remember that ensuring access to abortion is the only way to allow for equal practice of religious law across all religions. We look forward to seeing all of you at the bill signing. Thank you.